Welcome to Connecticut eHealth Podcast, educating, conversing, and connecting for better health. The Connecticut eHealth Podcast is a space where we get together with local and national experts, key stakeholders, and other individuals in the space of eHealth to discuss health information in Connecticut and around the country. This podcast is brought to you from the UConn Health Interoperability, Innovation, and Learning Lab, where our mission is to promote the optimal adoption and use of eHealth by providing education and engaging in conversation with leaders to create connections for better health. So let's sit back and get connected. Hello, this is Tom Agresta. I'm a family physician and clinical informaticist at the University of Connecticut, and I'll be your host for this episode of the Connecticut eHealth Podcast. Today's guest is Dr. Alan Davis, a Connecticut physician, long-term advocate for health information in Connecticut, and Connie board member. Connie is Connecticut's Health Information Exchange. His educational background includes a BS in electrical and computer engineering from SUNY Buffalo and an MD from the School of Medicine and Biomedical Science from SUNY Buffalo. He also completed his residency in the Department of Internal Medicine at LDS Hospital in Salt Lake City, Utah. Dr. Davis joined ProHealth Physicians in 2012 and was the regional medical director for the Western region of Connecticut from 2016 to 2021. He currently serves on ProHealth Physicians Advisory Board of Directors, the Clinical Council, and the Electronic Health Record Committee. Dr. Davis continues to serve patients full-time in his primary care internal medicine practice in Newtown, Connecticut. So Dr. Davis, tell us a little bit about yourself and how you became interested in health information exchange over the years, both as a physician leader and as a practicing clinician.
Thank you, Tom. It's a pleasure to be here talking with you. Shortly after moving back east to Connecticut in 2002, I joined a small internal medicine practice. We were not computerized other than for patient registration. I also became involved with a committee at Danbury Hospital called the Community Physicians Advisory Council. One of our tasks was to look for ways where we can help implement better computer technology caring for our patients both in the hospital and in the private offices. We were tasked with trying to develop a regional health information exchange, which is a smaller, more local version of the Connecticut Health Information Exchange. Unfortunately, there have been multiple false starts with the regional health exchanges and at least 3 attempts in Connecticut at coming up with the State Health Information Exchange. It looks like now that Connie has broken through and is becoming successful.
Alan, that sounds like you were really trying to solve a problem that you recognized was an issue with exchanging information around patient care, which is something that you and I share in common in terms of trying to solve over the many years. Can you tell me what challenges as a physician that you were actually trying to address through NHIE and how you were thinking about doing that through your work in both the regional HIE efforts and now in your role as a board member of Connie?
Unfortunately, now that we are more in a computer age, we still face the same challenges as we did 15 years ago. Many offices are still getting their information coming off fax machines. There is very little access to direct interface computer systems between the doctor's offices and outside hospitals, labs, and other testing facilities, and especially getting results from other specialists. One way that the Health Information Exchange can help with this is to have the results, reports, admission, discharge summaries come through electronically into the health records. Another problem we face seeing our patients with our current level of technology regards the patient's medication lists. Unfortunately, there are many inconsistencies with what our individual records say the patient is taking and how they are taking it. It's not unusual to get reports from other specialists or the hospital that have many inconsistencies with the medications compared to what is on my list, and how a patient is taking it and filling it can also be vastly different. One area where the health information exchange would be extremely beneficial is to have fill and compliance data coming in through the pharmacies.
So Alan, it sounds like that could really avoid some errors in medications that patients might inadvertently take the wrong medicine at the wrong time, or too many medicines, or not take one they should be taking. And I know that occurs, and it sounds like a health information exchange is going to help the clinician really facilitate that with the patient. So that sounds wonderful. Do you see other benefits, say, for healthcare organizations or for payers as well?
There are many different stakeholders that would benefit from the health information exchange. For example, when a patient with diabetes is seen in an individual practice, that physician can adequately care for their diabetes and try to optimize their hemoglobin A1C. But it's very difficult on the individual end to manage large populations of diabetics. The healthcare organizations, with the help of the health information exchange, can get more accurate data on how their diabetics are being cared for and where they can focus their interventions to try to improve their healthcare. This data is coming from multiple sources, and having it filter through the health information exchange into the healthcare organization's records would make it much easier.
That certainly sounds like it would be a great benefit, because obviously there's, not just lab data, but there's data on, looking for eye exams and foot exams, and what other services they receive. So that sounds like a win-win opportunity there.
There are also many other public health benefits to the health information exchange. If we are trying to target immunizations for children, or even target certain populations who have not received the coronavirus vaccines, the health information exchange would make it much easier to be able to reach out to the groups who are in need of these services.
So it sounds like being able to use it proactively is also an opportunity with a health information exchange. And when you think about your role in pro health physicians, that sounds like a real benefit. Can you tell us a little bit about how Pro Health is currently connected to the kind of other organizations from a health information exchange perspective, and where it may be going?
Well, before we talk about how Pro Health is connected to the health information exchange, I would like to review how we are currently connected with other institutions and other organizations. For every hospital system, lab system, and imaging organization, we have to have a separate interface. This was one issue I faced when I was a solo practitioner, where I had to develop my own data translation table if I wanted to get labs coming from Danbury Hospital, Quest, or LabCorp. It can be very costly to have and update all these different interfaces with other physicians and groups we interact with. Pro Health Physicians currently has separate interfaces with the major hospital groups who all use different systems. Right now, through Connie, we are going to have one interface where we would connect to the Optum Data Exchange, and that would connect through Connie. And the data would flow in reverse also from Connie to the Optum Data Exchange. So we would only have to maintain and develop one interface for all of our data.
And that sounds like a tremendous benefit in terms of even maintaining it over the long term and keeping it current. That's wonderful. We want to take this opportunity to thank Connie, Connecticut's official health information exchange. Connie was established in 2019 to oversee and provide services to support the exchange of health data in the state of Connecticut. Connie is an independent and not-for-profit organization. To learn more about Connie, please visit conniect.org or go to the show notes from today's episode. So, Dr. Davis, I know that Connie just launched recently, and that you've been a board member since the beginning. Tell us, from a perspective of a board member, What are your hopes for Connie? What would you like to see happen?
In order for any health information exchange to be successful, there has to be adequate funding and adequate enrollment from the larger organizations. Currently, Connie is involved with Hartford Health, Yale, Pro Health Physicians, UConn, and parts of Nuvance. This will be most effective if we have enough data coming in to service all of the different stakeholders, be it the healthcare organizations, the individual physicians, and the consumers of healthcare. It's all about caring for the patient and making sure the providers have the latest up-to-date information on the patients that they see.
And if you had to kind of look, say, a year or two down the road, what would you want to see Connie be able to provide in terms of, information and services to your practice?
From the physician's standpoint, I would consider Connie most successful if the physicians that are subscribed to their services have no idea that they are connected to a health information exchange. When we're seeing patients, we want the latest up-to-date information to come filtering into our electronic health records, regardless if it was done in my organization, Yale, Northeast Radiology, or Hartford Healthcare. The data we need to care for our patients should just filter into our electronic health records as discrete data that we will have available at the time we need it.
So like most clinicians, you want it really precisely in the right place in your workflow so that it's where you need it, when you need it, in the format you need it, so that you can best care for patients, it sounds like.
Correct. Another area where I see this benefiting our patients is with our population health services. The care managers would be able to use this data to look for medication compliance, look for ways they can better do outreach to patients and improve their healthcare. This can mean food insecurity, transportation to office visits, finding out who needs eye exams, or even medication compliance and other barriers to healthcare.
So it sounds like what you're describing is sort of care for the whole patient.
And populations of patients also.
True, very true.
Our Connecticut residents.
Can you tell me where your perspective is on what the current onboarding process for your organization, Pro Health, is with Connie at the current moment?
We recently completed our empanelment portion. What that is, in order for the data to be routed correctly to the different organizations who are caring for the specific patients, we need to provide lists of which patients are enrolled in our group. We completed that section. Now we are uploading what are called CCDAs, and from Pro Health to the Optum Data Exchange, and then up to Connie. Correct. Unfortunately, the CCDAs have a lot of information. Some of it is useful. One of my comments is it's easier to find out how much dinner they ate in the hospital than why they were seen in the hospital and what treatments took place. Hopefully, with the data parsing, that will go on through our exchange, and also for other outside organizations, there will be extraction of useful, relevant data from these CCDAs. This is just the first part. It will only get better from here.
So what you're describing is the concept that sometimes it's possible to get too much information, some of which is not relevant. And it sounds like your hope is that Connie will really help in the process of providing relevant information by screening out, things that are not relevant to the clinical care process.
Correct.
So, Alan, can you tell us a little bit about, what concerns that you might have, what fears you might have with regards to Connie, things that you hope don't happen, but you're concerned about?
Well, one of my concerns, again, would be making sure we have enough participants willing to share their data. Another concern would be, will there be enough funding in the years coming to support this endeavor?
So the funding question often comes down to value, and will others find value in it? It sounds like from your expectations, there'll be a great deal of value that will create the opportunity to bring in funds. But I think that that's a common challenge with health information exchanges throughout the country. The concern that they need to be providing value to receive enough funding to continue.
If we can show we're delivering better care, reducing medication side effects and other healthcare errors, if we can avoid ordering duplicate testing, that will surely reduce costs and hopefully help fund Connie.
I would think so. I share that sense of optimism about that. If you were to talk to organizations that have not yet sort of joined and are sitting on the fence and kind of thinking about whether or not it makes sense, even a small clinical practice, et cetera, what would you say to them with regards to your role as a board member and having tried this? I think you have a unique perspective, having tried to lead a small practice into getting engaged in a health information exchange. What would you say that's different now, and that you could say that would help convince them that it's worth the try this time?
I would try to elicit what their current pain points are. No matter how small or large a practice is, none of them have enough staff to do all the work that is required to maintain the records. Just getting, at least for our practice, we get about 150 separate faxes a day coming in.
Oh my.
Now, my practice is one of the unique ones in ProHealth where we have the faxes come in electronically into a folder on the server, and then they are indexed into the correct patient's chart. And the providers in my individual practice review those faxes online. It takes a lot of time to do the indexing part of that into the correct patient's charts. Other practices and organizations and other groups in my own practice are moving towers of paper around from different locations in the office, from the fax machine to the provider to the medical assistant, and then to the person who eventually does the faxing, the indexing, and the scanning. If being able to utilize the data coming in more efficiently and having that go directly into the appropriate patient's chart, that would free up the staff's time to do patient outreach, take care of messages, tasks, and other necessary requirements in each of their offices. Again, this was my issue when I was in a solo practice, in a medium-sized practice, and now ProHealth. And I can say that the other larger health organizations, talking to my colleagues, are experiencing the same pain points.
So it sounds like if we do this well, and we really reduce that sort of what I would call, in essence, useless work, because it's been taken out of many of the other business aspects, that we may well actually find that we get back to the joy of actually just serving our patients and caring for patients.
And also hopefully reduce costs and improve care.
Absolutely. So, Alan, do you have any parting wisdom for the listeners of this podcast that you hope they take away, the key message you'd like to have them take away?
This is a very exciting time for Connie. We are rapidly developing new services that will be able to enhance healthcare in Connecticut. We will be able to look up immunizations, assist the providers with the prescription drug monitoring, share images, and many other population health and outreach capabilities. And these will only be enhanced over time.
That sounds exciting, Dr. Davis. It sounds like it's a good time to be a board member for Connie, because you're really making a difference in Connecticut's, in the lives of all of Connecticut's citizens. And I really want to thank you for your commitment over many years to trying to have Connecticut have a functioning health information exchange. I know it's been a kind of a labor of love for you. And I really appreciate the time that you've shared with us today. And thank you for your time and your commitment to not just this podcast, but to the state's citizens to provide better health care.
Thank you, Tom. It's also an exciting time to practice medicine because in the very near future, we will be able to have access to all the tools that we will need to better take care of our patients.
I concur, and I'm very excited as well. So thank you, and have a wonderful day.
Thank you, Tom.
As always, wishing you the best of health. Your host, Tom Agresta.